Well, Dr. Randall Wolf is a leading innovator in minimally invasive treatment of AFib, atrial fibrillation. But he's also a professional magician who performs gigs all over the country. Dr. Wolf, cardiothoracic surgeon with Houston Methodist. Heart surgeon is with us. Doc, good morning.
Good morning. Pleasure to be here. Nice to meet you, Owen.
Nice to meet you too. Thanks for coming in. I was like, I don't know if we're going to start with the medicine or the magic. You brought your bag with you. I said, is it a stethoscope? And I don't know what's in there.
It's a doctor's bag, but it's filled with magic. How about that?
That's wonderful.
That's a little bit different. Well, maybe, people always want to see the magic, so why not just, when I see patients, I pull this out.
Okay.
And it's pretty simple. I take one card, 2 cards, 3 cards.
Okay.
Can your viewers see this, you think?
I think so. We can. We got this camera right here going right now. So
all right, so here are 3 cards.
they can see the 3.
And I tell the patients, you got to remember the card in the middle.
Okay.
I don't say it. But,
okay.
But that's
The
all
pay-
right.
Okay.
The King of Hearts, you got to remember the card in the middle.
Okay.
And it's easy to remember because that's the middle card. The red card is the King of Hearts. I take the King of Hearts, I put it right there. I show the other 2 cards. These 2 cards don't matter. I put them away. And I tell the patient, that's your card, you can keep it and take it home. Owen, show everybody what the card is.
Oh, it's
It's a business card. That's my business card.
what do you know? you want to call the King of Hearts?
There you go.
Am I getting it?
You got it. You're getting
man,
it.
This is great. It's a real card. Does this
that's
number
a real
work?
card.
If I call this number, this works?
Probably. Not right now, I'm not there.
You're not there.
But here,
Oh, I get to keep this.
you keep it. That's
Thank
for you.
Doc. I appreciate it. Well, hopefully I don't need to give you a call.
True.
So I don't even know where to start with it. How did you bring these 2 things together? Because this is a tool that you must use with your patients. What does it do? How does it help?
Well, I think when you boil it down, what most patients want are hope. When they go see a doctor, they want hope. They want some good news, and hope is probably halfway to happiness. And I think that's what people want with magic too. They want some happiness. They're glad to be fooled, but it's happiness. Yeah. And they both employ some similar techniques. So when I lecture about medicine and magic, I pull those together. And if you go back far enough in time, back to the Egyptians on one side of the Mediterranean and the Europeans on the other side of the Mediterranean, they combined medicine and magic. They were one. You ever heard of, the Egyptian goddess was Isis. She was the god of magic and medicine together.
Interesting.
And she was one of the most powerful gods. Her embodiment, human-wise, was Cleopatra.
Okay.
And again, it was medicine and magic combined. And if you look back at the papyruses, which is like paper to the ancient Egyptians, and read them, you'll see some that have 700 remedies. They're called magic, but we would call them remedies.
Right.
Going back to 2,000 years before Christ.
So when did you figure out that you were going to put them together?
Well, it's an unusual story. I was at my grandmother's house, and I was in the basement. There was a box there, and I opened it up, had magic in it. It belonged to my uncle. He went to medical school as well, and he left that box behind. This was in Cincinnati, Ohio. Another time, I was at my mother's parents' house, my other grandmother and grandfather, and I found a box there. It was my mom's brother, and he was also a physician, and he left a box of magic behind. I was about 12 years old, and I was absolutely fascinated. It was wonderful.
Had they ever done, your uncles, had they done tricks for you in the past? Was there
Uncle Art did, yeah.
Yeah, okay.
He did. Some card tricks, yeah.
Okay.
Cards were really big in Cincinnati because it's the home of the U.S. Playing Card Company, makes bicycle cards.
Oh, I got
They make 84 million decks a year.
So you wanted to be a magician before you wanted to be a doctor?
Yes, sir. That is correct.
And then you figured out, because I know we're running out of time. We want you to come back at some point and do some more tricks.
Yeah.
How do you find time for both and take care of your patients and do all your magic?
I just practiced a magic trick with you.
Do you do most of your entertaining in the hospital or with your patients?
I do a lot of speaking around the world. I have patients from all over the country, and I speak around the country. So I incorporate the magic into the lectures, which people want me to come back. I'm not sure it's for the lecture, Owen, or for the magic. Might be the magic. I'm not sure.
Well, I know you got some more tricks up your sleeve, and
Yeah.
I think we're out of time. But Doctor, really appreciate you coming in. I wish you the best of luck with all this. Hope you'll come back and do some more tricks for us.
Be happy to. Thanks for having me.
Dr. Randall Wolf, heart surgeon, magician. I bet the students really appreciate it.